Look at another spine issue, and this is what is known as a spondyloptosis. Spondyloptosis. So for spondyloptosis, this is what we got. It's kind of like the best image for it. So let's quickly describe it. Spondyloptosis is known as actually one of the most severe form of what? Spondylolisthesis. Okay, so if you have spondylolisthesis, which is kind of like one vertebrae sliding in the front of another one, you grade it. Okay, so the highest grade is actually what is known as a spondyloptosis. Okay, so it usually occurs at the level of L5, that's the last vertebrae before you have the sacral region. That's usually where you have this, so you can slide off. Okay, so location commonly at the lumbosacral junction is associated with what? High pelvic incidence and increased shear forces across the lumbosacral joints. So symptoms is there's a lot of back pains, neurological symptoms. That's like if a nerve is injured around that place now, then sagittal plane deformity, then a possible compensatory coronal deformity. Causes is sometimes people are just born with this. Sometimes it's trauma, had all those accidents. Then sometimes it's all those tumors, infections. So you diagnose it using X-rays, CT scans, MRI, then clinical examination where you're trying to evaluate the pain, how the patient is walking, and neurological deficits. So treatment, you can do surgical treatment and non-surgical. So for non-surgical, you start first, you manage the pain using drugs, then you brace. Then sometimes you have to do surgeries like fuse the spine, where you basically just gum it so that there's no movement at that place at all. Then sometimes you can decompress if there is a nerve compression.